Hello, everyone. Thank you for joining us today for our second episode of Samarpan. I am Dr. Manan Shah, President of the Maryland, DC chapter of the Indo American Psychiatric Association. I'm joined by Dr. Sunil Krishlani and Dr. Rachna Raisingani for our discussion today. Today happens to be Friendship Day in India and other South Asian countries, so we want to wish all our viewers a very happy Friendship Day. We're joined by two special guests today, RJ Rajiv Paul and Paroma Sanyal. Paroma is an economist by profession and an artist by passion. She's a writer, actor, dancer, and painter, all of which she uses to tell socially meaningful stories. Rajiv is a management, hi Paroma, welcome.
Hey, thank you.
Rajiv is a management consultant by profession and also a radio jockey with Radio Zindagi. He's an artist by heart and he's acted in full length movies and theater. His motto in life is Rajiv,
Yeah.
which means keep on living. So, welcome all of you.
Thank you so much.
Thank you.
So today is episode 2 of Samarpan. These are conversations about mental health, specifically as they impact South Asians. Our goal is to get everyone comfortable in the South Asian community with the idea of talking about mental health issues. We plan to introduce topics that we feel are important to this community. Today, our focus of discussion is how to recognize when professional help is required. We will have an enactment and showcase a common presentation of a mental condition that required professional attention. We are fortunate enough to have these two actors, Rajiv and Parona, perform a scenario for us. This skit will be in 4 acts. After each act, we'll take a brief pause and discuss some important points. Please keep sending us your questions as you see this skit and as they come to you. We will address them to the best way we can. We'll also be learning into what are the different types of mental health professionals, and we hope to address fears and barriers in getting such help from a mental health professional. So here is Act 1.
Payal, Payal,
What is it, Shekhar?
I'm late. I'm sure I'm going to get yelled at today. This will be the fourth time I will be late for a meeting this month.
Oh, come on, relax, relax. Just tell me what you'll have for breakfast first, okay?
I'm not hungry. I told you I'm running late. Don't you hear?
But Shekhar, look, you've been up 4 in the morning. You were just tossing and turning. You didn't get rest. And why haven't you been going for your morning jog?
Payal, I feel tired. I've become so absent-minded. I'm sure I'm going to get written up and laid off. The business is not doing well, and I'm sure they're looking for the bakras to blame and lay them off.
Shekhar.
याद है तुम्हें पायल? I left and came back to get my keys and phone twice this week. सब भूल जाता हूँ यार. I've not been able to focus on my work. My quality is slipping, and it is taking me longer to do something that I could have done in a short span of time. Things are not right, Payal.
Shekhar,
Please.
Shekhar, listen to me. Listen to me. Look, why don't you take a week off, okay? I mean, you have so many PTO days left, right?
Have you been hearing what I'm saying, Payal? I'm telling you, I'm getting slow and sloppy, and I might get fired. And you want me to take time off?
Shekhar, listen. Look, I'm worried about you. I mean, you haven't been playing with the kids. You haven't listened to your favorite Kishore Kumar in days. And and even your blood pressure has been higher. You you even forgot to call your mother on her birthday. She keeps calling me and asking about you. Shekhar, you are all she has.
I'm so sorry, Payal. I'm so sorry. I'm neither a good father, nor a good husband, not a good son. I'm such a loser. I'm losing everything, Payal.
No.
Just feel like
No, Shekhar.
This was Act One. Rachna, when you saw this Act One, what do you think is going on with Shekhar?
Well, I thought that he looks quite down. It seems like this is not his usual self. From what Payal was describing, it seems like he's a much more lighthearted person. He's gone through a lot and accomplished a lot, and he's coped with stress differently in the past. This time, it seems like something's off with him, and it's not just going on for a short time, but it seems like it's gone on for a while. His health is deteriorating. These could be some of the beginning signs of depression. So that's probably what I'm worried about with him.
So when you were looking at this act, could you maybe highlight what are some symptoms of depression that you saw that made you think about depression as a condition that he might be going through?
Sure. So, anyone can be under stress due to a bad situation, like the COVID crisis we have, or a job loss, or some other stress in life. And it is not abnormal to have a few days of where someone may not be able to sleep well, feel more irritable, or lose interest in things. But when the same thing goes on for a pretty long time, and it starts affecting their sleep, their food habits, the way they engage with other people, their level of interest in things, and the way they start feeling demoralized or helpless in a way, I think then things are going towards more of a mental illness and depression, where it starts becoming necessary to get help. So, Sunil, we see a lot of people from different backgrounds. Can you highlight for our viewers how is it different in South Asians compared to other communities?
So, just to give you some kind of numbers from my own practice, I've been practicing in this area for like 20 years, and I must have seen thousands and thousands of patients who have come to me with various mental health conditions. But I've probably seen maybe less than 20 people from South Asian community, which tells you, I don't think the incidence of these conditions is any less in South Asian communities, but there is a huge reluctance, a huge resistance to even labeling these conditions as mental health conditions. And resistance to this idea can come in various forms, from outright denial to maybe minimizing it, to attributing it to some other problem, there's a tremendous amount of shame, stigma, associated with these things, and it makes it hard for people to kind of seek help. And I think that's probably the biggest thing I find amongst the South Asian community, is that they'll try to find any other explanation except that this is a psychological condition.
Okay. Just a quick question for audience, reminder for audience, if you have any questions or anecdotes to share or experiences to share, please feel free to send those as your comments on the Facebook live stream. I'm curious to see how Act 2 unfolds and what Shekhar and Payal are going through. So can you walk us through those?
So before we go to Act 2, just wanted to ask Manan. Manan is a child psychiatrist. Manan, have you seen any differences or different ways of presentations in when a child comes to you or an adolescent comes to you? How does a South Asian family, are there any additional things that you would want to talk about in this case?
Yeah, so what I would like to say is that in my experience, South Asian families will put a lot of emphasis for their children on achievement. They will usually try and talk about success or failure as presenting issues. If they feel like their child is not performing as well, academic issues tend to be one of the biggest concerns. And oftentimes I've seen that they will not give a lot of emphasis to feelings, but they will mostly look at external behaviors, and they will, external behavioral concerns is what brings, is what makes them bring their child for help. So I think it's important for families to also talk about their child's feelings, to really get to know what their children are feeling. So that's one difference that I often notice.
All right, let's see Act 2 and see how this plays out in their family.
Shekhar, just listen to me once, okay? I think you need help. Look, why don't you go and speak to Dr. Sharma?
Payal, he's our primary care doctor. I know what he will say.
Shekhar, listen. Listen, he knows our family history. He knows us for 10 years, right? And look, I'm sure he'll figure out what needs to be done. And look, if listen, if not for anything, I'm sure your pressure medication at least needs to be adjusted, right? I mean, look, Shekhar, afraid that this rate, you're going to get a stroke or a heart attack. Please, I think you need help for your stress, Shekhar. Please. What? Listen. Okay. I understand. Listen. Then why don't you go and talk to somebody at your what is it? Employment EAP, Employment Assistance Program.
Are you kidding me?
What?
I don't trust anyone at the Employee Assistance Program. कुछ भी सुनते हैं, किसी को भी बताते हैं, कुछ भी करते हैं. I'm sure the next phone call will be made to my boss Brady.
नहीं शेखर, ये बात नहीं है. Listen, Brady is your supervisor, right? And there are laws about this. You know that people in EAP can't just disclose your private information to your supervisor, right?
Payal, you just don't understand our office politics. I have given many months to this firm and I have bagged them so many contracts. Yet when it came time for promotion, पता है ना क्या हुआ था उस समय? I was not even considered, Payal. When Brady came home for dinner, जब तुम्हें बुलाया था, तो क्या एकदम प्यार से बोला था उसने? Whoa, what you saag paneer, what naan, he was praising all that. He was talking like he was my langotia yaar. But they're all the same. When it came time for promotion, I did not even exist, Payal.
Shekhar, look, I understand. But you know what? Ever since that party and that announcement that they picked Susan over you, you've just not been the same.
क्यों याद दिलाती हो पायल तुम हमेशा क्यों पुरानी बातों को याद दिलाती हो? All that I have done for this company, what more could I have done? It's so depressing.
Shekhar, it's not what you could have done. Look, all I'm saying is please, you need to talk to someone, okay? Because whatever I say seems to irritate you nowadays.
I don't trust anyone at work. I don't trust anyone at all, Payal.
Fine. But then how about, going to a counselor?
Counselor?
Yeah.
मैं तुम्हें पागल दिखता हूँ? मैं पागल दिखता हूँ? I'm just upset. I'm not crazy.
Look, Shekhar, that's not it. Listen, just listen to me without getting irritated for once, okay? Look, you've been like this for 2 whole months and I just can't see you like this. I can't take it anymore. Sometimes I'm taking the kids and going away somewhere else. I mean, Shekhar, it's not you. You've not been nice to the kids. You've not been nice to me. And you won't even take care of yourself, Shekhar. I mean, I just can't see you do this to yourself. And you know what? Sometimes I'm afraid that if I just leave even for a week, things will go from bad to worse. And Shekhar, it breaks my heart to see you like this.
पायल मैं पागल नहीं हूँ मुझे पागल मत बनाओ पायल मैं पागल नहीं हूँ
Shekhar,
मैं पागल
Shekhar, I didn't say that.
So sad. I'm so sad.
So you saw Act 2 and you saw how this plays out in the couple's life. Rachna, what were your thoughts when you were watching this act?
Wow, it seemed quite painful to watch because of the tension between the two. So I was just thinking that even though Shekhar is the person who actually has the condition, or he's the one that is primarily suffering, but I was just thinking about the toll that it can take on people all around. So, how much distress it was causing his wife, his mother got stressed about it. The kids are scared of him. It clearly seems like this is also affecting his work as well. So, that's the impact of mental health conditions, especially things like depression, where they have a pretty big impact on people and society at large. So I think that really tells me that we should be addressing this on a very active scale, or a war footing, in fact.
So one of the things I saw that, which I was talking about, was the sheer fear that people have in terms of bringing this up. I mean, you can see he's afraid of telling anybody at his workplace. He's afraid of even going to EAP. There's a limited understanding of privacy laws and how, it's not going to just spread like wildfire once he brings up this. I give that, sometimes some people may not keep this information confidentiality, but there's a very high degree of mistrust in the whole system. And you can see how that kind of makes them literally be in their own mental prison, not able to get out, not able to know whom they can trust and whom they can talk to.
Yeah. How do we make this easier, Sunil, Manan? How do we bring people out from these internal prisons and get them more to the front, and be open about these things, and be open and willing to get help?
I think one of the things that we definitely think is more important is to normalize these conversations, which is partly the thought process behind this whole series. Is that the more we talk about these, the more commonplace these things will be. I mean, we have to be careful to talk about them in a sensitive way, in a respectful way. Like one of my advice to family members would be that whenever you talk about mental conditions or people suffering from mental conditions, talk about it respectfully. Don't use words like iska to fir gaya, ye to gaila hai, yeda hai, pagal hai. If your family members hear you use these terms, they themselves are suffering with this condition or a condition like this, they're not likely to come to you, because they will feel like you will ostracize them, or that you will criticize them, or you will blame it on something else except what it is. And I think this kind of sensitivity, this kind of willingness, this kind of normalization has to start at home. And I think so. This would be my first suggestion to people, is to just start talking about this, just like you would talk about maybe your diabetes, or maybe COVID, or maybe upper respiratory tract infection or hypertension. We don't seem to make it so such a taboo topic, or we don't raise it to such a pedestal where we feel like, oh my God, what are we talking about? Are we quickly trying to sweep it under the rug? We try to talk about them as if it is just one of the other aspects of life. And I would say the same thing about mental illness or mental conditions. What do you think?
Right.
Yeah, I think I very much agree with you. And I think this kind of conversation should also be extended to children. Children in the home should also be kept informed about these things. Parents should be open about asking, just like how a parent would ask a child, did you have a headache today, or how was your day today, or what did your teacher say? It's okay to ask, how are you feeling? Have you been feeling sad lately? Have you been feeling worried? Have you been feeling anxious? What kind of things make you angry? So I think having those kind of discussions with children will also help children. The normalization will extend to kids also, because I do see a lot of the hesitation in parents gets transferred over to kids, and kids will also be reluctant about getting mental health, because they'll be like, what do my friends say? So I think having these kind of conversations applies to all family members, including young kids.
Okay.
I think I wanted to make one more point here about stoicism. So I think that is really ingrained in the Indian culture. Again, being the Bollywood fan that I am, and we all are, if you remember this one line that says, "Mard ko dard nahi hota," mard bhi insaan hi hai, usko bhi dard hota hai.
Yes.
And that's a fallacy. It's not like you are not so. We are all human, and
Right.
it's as normal as getting a cold, cough, or fever to have anxiety or depression, and from time to time need help for it. So we need to destigmatize experiencing these normal emotions of life as well. And when they get to be a little bit difficult, then getting help for it. I'm I would ask you, Sunil, can you tell us a little bit about the stages of change? Like, how do you push someone from being like, I don't need help, or I'm fine, to maybe I could benefit from help?
So, the word that comes to my mind that I want everybody to reflect on for a minute is ambivalence. I mean, think about anything that you yourself have tried to change, whether it is the fact that you want to lose weight, or you want to give up some bad habit, or you want to start a new exercise routine or a new study routine. We all go from a stage of either being in denial about it or minimizing it to this stage of ambivalence. By ambivalence, I mean we are in two minds. Part of us thinks that it's not such a big problem, and part of us thinks that it's something we should do about. And we keep going back and forth through this thing. And only when the forces that compel us to change get to be very high, and the forces that compel us to stay the same diminish, that's when we take the first step of maybe asking the right questions, or maybe asking for help or doing something to change that. But ambivalence is a very natural, normal phenomenon that is seen in every human being across the spectrum. We feel it more when we see people come to our offices for help, because you see this tug of war, this push and pull that is happening between you and them. You want them to do a certain thing, you want them to stop doing something or start doing something, and they kind of resist you by either pushing you away through their dialogue or through their actions or through their behavior. And this kind of push and pull goes on. So one of the things I do is I try to reflect with them about, what is wrong with the current state of affairs. Like, what is not working for you? What is not going so well for you? And I also try to imagine with them, what would that desirable future be like? Like, okay, to Shekhar, if I were to ask, I would ask Shekhar, if you were to have, less fear or less sadness or more energy, or, feel like you can concentrate, how would you be different? And what would that be like? How would that change the relationship between you and your family? So once I find that I show them the desirable future state, they're much more likely to then be curious about what can I do to get there, because they also in their hearts want to get there, but something is holding them back.
Shekhar ka kya hal hoga?
Yeah, so let's see Act 3 and see how this plays out.
Hi, Dr. Sharma. How are you?
Hi, Payal. Hi, Shekhar. I'm good. How are you both doing?
I'm okay, doctor. But you know what? The reason we are here today is I'm very worried about Shekhar. He just has not been himself lately.
Okay. I see. Shekhar, tell me a little bit more about that.
I'm fine, doctor. Payal.
Shekhar, you're not fine. You know that. Please tell him. Please. Come on.
Dr. Sharma, just Payal wanted me to come and see you because my blood pressure has been a little inconsistent. But I feel totally fine.
No, and tell him you haven't been sleeping well.
Payal, हर चीज को.
नहीं, Shekhar, please, बताओ ना. Come on.
Tell me, Shekhar, tell me about your sleep issues. What's going on?
Yeah, Dr. Sharma, everybody at this age goes through this. Like, I was having good sleep, and lately I am not. I've been getting up in the middle of the night, but it's all normal.
Shekhar, tell Dr. Sharma about your job and how stressed you are. Tell him.
Dr. Sharma, little bit stress at work. There's just little bit stress at work. I was supposed to be promoted. I did not get promoted. I was promised promotion. And kisko stress nahi hota hai. I do feel sad. Number of occasions I do feel sad. I get up in the middle of the night, worrying about my job, worrying about myself. The things are a little abnormal, like what it used to be.
Okay. And what about your blood pressure? Have you been checking it? Because it's pretty high today. It's 160 by 102. It's the highest that it's been for you ever.
Look, Dr. Sharma, see, I'm telling you, he won't agree with it, but he's not been jogging, he's not been sleeping well, he's stressed.
Nothing like that. Just worrying a little too much. Dr. Sharma, I'll take care of myself.
See, both of you are hesitating. I can see that both of you are giving me very different accounts. बात क्या है? थोड़ा खुल के बताओ मुझे.
She thinks I'm stressed and is afraid that this will kill me. So she just wanted me to come and talk to you.
Okay. Tell me about your difficulties at home and work.
Come on, tell him about Susan. Tell him a little bit more about work. Come on, please, Shekhar.
Yeah, I'm still upset about it. Everything seems so unfair, Doc. It's like I'm putting in 100% at work and I'm not getting what I needed to get. I'm upset about it. Yes, I'm upset about it.
Okay. Shekhar, do you feel like you're losing interest in things that you typically enjoy?
Yes, he is. Tell him.
Yes, I don't feel like listening to songs. I used to love Kishore Kumar songs. I don't like to listen to them anymore. Or if I do, I'm only listening to sad songs or ghazal. I start crying in a few minutes. I don't like it. Yes. Things are not normal. I'm not enjoying life the way I used to enjoy life.
Okay, I hear you. And what about any changes in your appetite?
Oh, yes, Dr. Sharma, like yesterday, I made his favorite biryani and he just took 3 or 4 teaspoonfuls and said he was not hungry anymore and he was full.
Okay. Shekhar, tell me honestly, have you started feeling like you want to give up or you want to go to bed and not wake up?
I
Go
actually
on, go
yes,
on.
yes,
You're doing
yes,
fine. Tell me.
yes. Actually, yes. I will be honest. Yes, I feel sad. I don't want to. I just want to give up. I just want to give up.
Shekhar.
Okay.
This week I kept thinking of Guru Dutt. Can you believe that? I was thinking of Guru Dutt. Did you know that he committed suicide? He was so bright and talented. I don't think I can do that to her and my kids. I feel bad even thinking about it. But thoughts keep crossing my mind.
I see. Shekhar, tell me, have you been having thoughts of suicide? Do you feel like you want to end it all? Does this seem, is this similar to when you get normally stressed or this seems different?
Not at all. I usually can brush things off easily, Dr. Sharma. All I have to do is listen to my Kishore Kumar playlist, and in no time I'm singing along, I'm having a good time. Or I will try to cook a new dish and I forget my worries. This time, it seems different. It seems like I've changed completely. I've changed permanently.
I see. Well, Shekhar, do you really want to know what I think honestly?
You think I need to go to the hospital?
No, I don't necessarily think we need to go that far, but we still need to take this very seriously. Um, do you feel like you might be turning into your mom?
Remind me of that, please. I'm afraid you would say that. I was really afraid about that. The history catches up. Is that obvious, Dr. Sharma? I did not like how she had changed. I watched her and I'm now not liking how I'm changing. This is not me. Is this permanent, Dr. Sharma? Do you think?
See, Shekhar, as far as your mom, I hadn't ever met her, but based on what you've told me about her in the past, it sounded like she was probably suffering from major depression, and it's pretty common for somebody to have depression after a heart attack, which your mom went through. To me, it seems like you might be going through a moderate degree of depression. I know your mom never really got any treatment, but I'm glad that you both are here to get help for you. This is a very common and treatable condition, by the way.
How? I need help. How, doctor? Please tell me.
Okay. So, Shekhar, thank you for acknowledging that. At this point, I feel like there are a couple of ways of proceeding. We could either consider a medication for you or consider psychotherapy or counseling. Would you be open to considering either one of those?
Absolutely. Absolutely.
Okay, so I do know a very good therapist. Her practice is not too far from here, and she's really good at what she does.
I prefer not to take any medications for this or even use my insurance, doctor. I don't want anyone else to know about it. Doc, do you think she will understand me and our culture? Will she be able to keep this private?
I hear your concern, Shekhar. So, see, she's not from our background, but she's very skilled and understanding, and she comes with a wealth of training in a form of therapy called as cognitive behavioral therapy. And she's graduated from a very reputable institution. I've sent many of my Indian, Pakistani, and other South Asian patients to her. They all really rave about her. She'll communicate her findings to me directly, and anybody else that you give consent to. She can also see you as an out-of-network patient if you want.
Thank you so much, Doc. I don't want to see anyone from my culture, to be honest. I'm afraid I won't want to see my therapist in the temple, mandir mein ghumte hue, or I would feel like uske samne pagal ghum raha hai. That would be very awkward meeting that person. So, yeah, anything out of the network or someone of different culture would be helpful. But I'm ready to proceed, doctor. I want to get better. I want to get better.
Good, good.
Shekhar, thank you. Thank you.
Thank you, Payal. Thank you so much for bringing me to Dr. Sharma. I know it's going to be difficult, but I want to work with you, Payal. I want to feel better.
So you can see how ingrained this whole idea that any kind of mental issue means that he's pagal. I mean, this idea that this is madness is so ingrained in him. Even at the end, after Dr. Sharma tells him, like, I think you're going through a moderate degree of depression. He keeps using the word pagal. And I think you could see some other clues of resistance here. Like, he doesn't want to use his insurance. He doesn't want anybody from his community, even if they were a mental health professional, to see him. According to him, they won't uphold the ethics of privacy or confidentiality. They will immediately start blurting out his case to other people in the community, in the temple. He's afraid he will run into them, and the minute he runs into them, everybody's going to know. There's all these magical ways of thinking, like how this thing that is just between him and his therapist will suddenly spread like wildfire, and everybody will come to know about it, which kind of still paralyzes him. I think it's interesting to see that at least he has, I think Dr. Sharma did a superb job of being gentle, being sensitive, trying to not jump right into the solution, but gauge his reluctance, his willingness, and slowly kind of guide him to that decision-making process. The ambivalence that I was talking about was, you can see very clearly, he said no to medication, but yes to therapy. The minute he said therapy, he said no to an Indian or a Pakistani therapist, but yes to a non-Indian psychotherapist. And Dr. Sharma kept, having that dance with him. I mean, one of the things that it reminds me of, a good interaction between a therapist and a patient, or a doctor and a patient, should be more like a ballroom dance. It should not be like a wrestling match where you're trying to pin somebody down. The idea is not like, got you and I have this one thing over you. No, it should be more like a dance. Sometimes they should lead, sometimes you should lead. But there is this constant attentiveness that one needs to pay to their body language, to their facial expression, to what they're saying, so that you get a sense of, are they resisting? Sometimes a way in which people resist is that they say yes to everything, but their yes seems very insincere. Their yes seems they're really not going to follow through. The minute they leave your office, they're not going to follow through with that. I rather that people say no and ask me questions than say just say yes, and then just not do what I'm telling them to do. The one clue that I get that patients are getting more engaged is, as the session proceeds, I see that they start asking more questions. And if they start asking more questions, I know that I have now gotten the wheels of change to start moving. And that's a good sign, in my opinion. What about you, Manan? How do you see this play out in when there are three people in the room, you, the child, and the parent?
Yeah, I think a lot of my work is work with families. A lot of times, there is a lot of things that families are not really open about. They again, in the, a big thing in the South Asian community is log kya kahenge, what will people think, what will people say. So if there is a lack of trust, lack of concern about confidentiality, they don't really tell me openly what is going on, and that's why I get very different accounts from what the child is telling me versus even sometimes both the different parents say different things. So I think first of all, trying to really normalize and validate and be non-judgmental when you hear about these concerns makes people be a little bit more open, and ultimately, like we saw in this Act 3, both of them finally agreed and agreed and acknowledged the problem. And I think one really important thing in this act was this session was not just for Shekhar, but we saw the relief on Payal's face. Like a lot of times, seeking help can be so validating for a family member. Payal had told us that she was feeling so worried, and she was also going through her own difficulties because of Shekhar going through this. So it was so important for and validating for Payal too.
I mean, in family therapy, they used to teach us that the person who gets presented to you as the patient is the identified patient, and everybody else in the family is the unidentified patient. It's like a whole system that you have to treat.
Yeah.
And to always keep that in mind, that they may also have their own, caregiver burdens, their caregiver worries, their caregiver burnout, depending on how chronic or acute the problem is. And it's really important to just be vigilant to what the family members are going through. There are some real concerns. Yes, employers are not very trustworthy. Yes, some therapists are people who will speak out your private things in a public space. So some of these fears are truly not unfounded, but everybody's not like that.
Right.
It's interesting that this couple went to their primary care doctor. I wanted to ask Rachna, what are the different types of mental health professionals that people can get help from?
So in the US, I would say almost 70 to 80% of care for mental health issues or treatment for mental health issues is provided by primary care doctors or in the offices of primary care doctors. So, and more often than not, people are required to have PCPs or primary care doctors through their insurances, etc. So that would definitely be a good first step. Even if they cannot treat you, they usually have a network of trusted specialists or other professionals that they can then refer patients out to. So I think that's a good start. Just how Shekhar and Payal approached Dr. Sharma. Sometimes you can go directly to psychiatrists or to other mental health professionals like counselors who could be both psychologists or social workers, then trained in different kinds of therapy. So these are some of the professionals, both in India as well as the US, and I'm sure some variation of this are across the globe, basically.
I think also people can also look at their nearby teaching hospitals. Usually teaching hospitals, academic centers, big hospitals generally tend to have departments of psychiatry or departments of psychology. In India, I've seen some hospitals don't have departments of psychiatry and that can be a problem. So I think they can start with their own family doctor, and the family doctors usually will know who in their community, who in their suburb, who in their city is a good mental health professional, and maybe refer them to that service.
So there was one point. Sorry.
No, I'm saying the same thing applies to children and adolescents. Start with your child's pediatrician first. That would be a good place to bring up the concerns. Sometimes some people do well child visits. So if you have regular checkups with the pediatrician, bring these issues up with your pediatrician.
So there was a point I wanted to make that on one hand, we are talking about dispelling stigma and talking openly about these things. On the other hand, we are talking about protecting confidentiality. So I think I just wanted to clarify that all mental health professionals, all doctors or all health professionals, I would say, undergo this training and are required by their training to uphold the confidentiality of their patients. We are in fact taught to not acknowledge patients in any way when we meet them in public unless a patient initiates contact. So similarly, in order to dispel stigma or be open about these things, doctors cannot talk about patients. If you yourself have a mental health issue, start by having some real conversations, maybe not on a public forum, but with some trusted friends and family members. And this will serve two purposes. One is if they have seen you behave with them in a way that maybe was hurtful or confusing or just not like your usual self, they will get a better sense of why this was happening. So it will strengthen your bond. Plus, uh, confiding in someone is a very good way to strengthen relationships, and then this may also encourage other people to get help for their conditions. So this is how stigma will be broken down bit by bit. It will not happen from the side of professionals. It has to be from the side of the sufferer or a patient. So I just wanted to highlight that part.
And I think this is specifically ingrained in mental health professionals more than general health practitioners. Like I still see many general practitioners talk about patients, their patients. Sometimes I've even, seen them um, mention names of people, and I cringe when I hear that, and I feel like, how is he talking about this patient with me or so freely, and to me that's concerning. So I think people automatically then extrapolate to think that, yes, my doctor talks about this patient with me. Similarly, if I tell my woes or my worries to a mental health professional, they'll start talking about my problems with somebody else. I think the bar for confidentiality is much higher for mental health professionals, at least in mental health training or in psychiatric training. Like I am an addiction psychiatrist, and the bar of privacy is even greater than just mental health. Like I can't even disclose to their primary care doctor if somebody comes to me with an addiction problem unless they specifically sign a document saying, yes, it's okay for you to do that. So I think there are various gradations of privacy, and as you go into more and more specialized fields, the bar of privacy is much higher. And I think people sometimes don't know that, and because of which they limit what they share with people. The other thing you can also do is do a test. I would share something that you consider, let's say, important to you, and see how this person handles it. If you feel somehow that this information leaked out, then maybe this is not the right person to trust. And I think the problem is, because there's not that many choices, let's say in a place like India or in a place like that, you may be stuck with whoever you get as a good referral. But here people have many choices. If somebody does not uphold your privacy, you don't have to stick with them.
So we've been getting some questions from the audience. Do you think we have time for one or two of them, or should we go to Act 4?
Let's take a question or two.
Okay, so one question is that, do you agree that the major cause of depression in kids is pressure exerted by their parents? Manan?
Yeah, so yes and no. No, in the sense that no, that's absolutely not one of the commonest causes. There are lots of things. We have to think about even genetic history. There's a lot of issues like there's like social problems that goes on, bullying that goes on. There can be many other factors that could make depression worse or that could trigger these kind of episodes. Certainly, we can't ignore pressure from parents. So if you see that your child is not doing well, instead of, and again, this kind of goes back to how to non-judgmentally talk to your family member. If you see that your child is struggling, it's best to ask questions about what is going on, what are they feeling, do they feel like there is a problem here, do they feel like, what do they feel is going on, why are they struggling? Instead of jumping to just immediately providing solutions or immediately being judgmental by saying, oh, you're just not working harder, you just need to work harder, you just need to study more, you just need to wake up early, and things like that. So certainly I would say that it's important to recognize that the pressure that parents put on kids may be a factor, but again, like I said, that's not the only factor.
So can you give us some more examples of judgmental and non-judgmental communication?
Yeah, so when a person like Shekhar says that he's going through something, a judgmental response from a family member, which is not appropriate, is something like, well, what do you have to be depressed about? What do you have to be upset about? You have everything. Or, you were just fine a couple of days ago. What happened? Or something like, oh, you just need to exercise a little bit more and everything will be fine. Those are judgmental responses. Non-judgmental responses would be something like, asking questions like, first of all, validating by saying, I'm sorry you're going through that. I didn't know. Tell me more about that. How are you feeling, or what do you think is going on, or how can I help? What can I do? I'm here for you.
Okay, that's good. Um, and I think we should. Um, are we ready to see how this resolves in Payal and Shekhar? Let's see Act 4.
Hi, Payal.
Hey, Shekhar.
Do you know what the counselor said?
First, you whole new person, just like your old self. And you seem to have a lot of trust in her. And it's been 3 months since you've been going to her regularly. I'm so proud of you.
Payal, I never thought I had so much to say. I never thought that I could open up to someone who is not from our culture. I never thought she would understand me. But Payal, she was so patient. I never felt she's being intrusive. When she said that she wanted to talk to me alone, I was very uncomfortable at first. Actually, I've never spoken to anyone alone like that. I've never shared things with anyone other than you, Payal. It was,
It's okay. It's okay, Shekhar.
but she told me it was important to find my comfort zone again, and that can take time.
Yep.
It
You
was
know
really
what?
good.
You know I trust you, right? I mean, you don't have to worry about me. I'm just really happy that I'm seeing you smiling and eating and sleeping and yodeling your favorite.
Jum 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 ru. मैं हूँ jum 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 ru.
Yep.
फक्कर बन के ru ru. Oh, so happy to get back into my normal self.
And you know what? I just love watching you and the kids enjoy Xbox together. It's really heartwarming. And I still can't get that controller, you know that.
Seriously,
Mhm.
it's so easy. I can teach you, Payal. I can teach you.
Nope. The kids have tried a few times and I'm not interested. And you know what? I haven't heard you complain about work either.
क्या फायदा? क्या फायदा? You know what? She has taught me about how our minds deceive us. She thought I was unnecessarily personalizing what happened at work. Work is at work. उनको चिंता करने दो. Why should I take it upon myself कि मेरे कारण, इसके कारण, उसके कारण? She taught me all those kind of things. She's teaching me cognitive behavior therapy and tells me that I can think in black and white terms. It sometimes she says I think in extremes. राय का पहाड़ बना लेता हूं मैं, छोटी सी बात को इतना बड़ा कर देता हूं मैं, इतनी चिंता करने लग जाता हूं. She taught me how not to worry about those things. I'm
And
so happy.
Shaker, as a result, your blood pressure is also back to normal.
I'm so happy, Payal. I did not have to take any antidepressant, although she reassured me that if I got worse, then she would absolutely recommend it.
Yep.
It seems so logical, right?
Exactly. But forget that. You know what? Now you should sing nope, not
Kishore,
Kishore Kumar.
Kishore,
Nope,
Kishore,
nope,
Kishore,
nope,
Kishore.
nope, nope. Ruffy song, my favorite.
Come on, Payal. Ruffy song of
Yes.
all the people. I
Mhm.
know, I know, I know, I know. Or you know what? There is a Ruffy song that fits right here, and I have started to live that life now.
Okay, let's hear it.
मैं जिंदगी का साथ निभाता चला गया टिंग 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 हर फिक्र को धुएं में उड़ाता चला गया हर फिक्र को धुएं में उड़ा देखो गा दिया तुम्हारे लिए मैंने रफी का गाना भी Payal, thank you so much for guiding me through this. I was going through such a hard time. It was so difficult for me to accept what I was going through. But thank you for holding my hand. Thank you so much for taking me to Dr. Sharma. And thank you, Dr. Sharma, for guiding me through this thing. I'm happy now. मैं हूँ झुम 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 झुमरू फक्कड़ घुमरू बन के घुमरू मैं ये प्यार का गीत सुनाता चला चलो गाएंगे मस्ती करेंगे ऑफिस में जो हो रहा है होने दो
Exactly.
और कभी भी राई का पहाड़ नहीं बनाएंगे.
And seek help if you need it.
Absolutely, Payal. Thank you so much.
So you
That
see,
was awesome.
it was good to see how, through work, they were through working with a therapist, they were able to get out of this. One point I wanted to make over here was, even if Shekhar would have chosen medication, he would have been okay. I think everybody has different choices, different ways of coping with problems. There are many, many good antidepressants available, at least 25, 30 antidepressants available. And even if he would have gone that route, he would have probably been okay. I think there are some differences in what you get out of each pathway. Like if you would have chosen medications, yes, sometimes the responses could be quicker. You might see a response in 2 to 3 weeks. If you went through therapy, it might take a little bit longer to get that response. And the difference is that sometimes when people engage in therapy, they develop better insight, they develop better coping skills, they develop much more long lasting changes, which may not be seen with medications. I mean, medications, let's say you take them for 6 months, the depression might lift, but some people who have a tendency to have recurrent depression, the depression might come back again and you may need to take them again. Whereas with therapy, the belief is that if you've had good therapy, if you've done good, internal reflection and practice, you may maintain these changes for a much longer period of time. What do you think, Rachna?
So I would agree with most of what you said with a slight caveat. So
Okay.
I think it's important to recommend a solution depending on the problem. Now, based on how Shekhar presented, I think he had what we would say maybe moderate up to moderate depression. But when things get severe, there is no choice but to give medication. I'll compare this with, say, diabetes, cholesterol, or high blood pressure. So, you know how if you go to your doctor's office and your blood pressure is creeping up a little bit, or your sugar numbers are higher, or cholesterol numbers are higher, your doctor might first tell you to do some dietary and lifestyle modification. So, I would say those maybe would be the equivalents of therapy. But if your blood pressure is coming at 170, or your sugars are jumping into 2 and 300s, then there is time to introduce medication, and only lifestyle changes or modifications in diet will not cut it. So I think similarly, if depression is very severe, uh, someone may not even have the motivation to seek therapy or engage in therapy. So then to bring them to that level where they can actually meaningfully do something in therapy and get some benefit out of it, there is need to give people medication. So I want to remove this fear of medication from people's minds. And just like you may need antibiotics or other medications, there is a role that and psychiatric medications will also play, and the treatment can be bolstered with therapy.
Yeah, and I think there was a response from the audience which rightly said sometimes you need both. Just like
Yeah,
with diabetes, you may need dietary modifications,
correct.
health modifications, exercise, and you may need metformin or insulin. Similarly, with depression, you may need therapy and you may need medication, and it's okay. Depending on your problem or the severity of the problem, you would need one or both or either. The other thing, I wanted to talk about a little bit was this issue about, we highlighted a case of depression here, but this is not the only case where you would need help with professionals or mental health professionals. Like some other conditions where you might need professional help is really one based on severity. Like I think about, if it's a mild problem, it just is a feeling. If it's a moderate problem, it begins to start working and affecting your workplace, your education, your family relationships. And if it's a severe problem, it can completely incapacitate you, or it may be life threatening. So anytime the problem is moderate or severe, you may need to consider professional help. The second thing is, there are different types of chronic or persistent conditions. Like depression was one thing we talked about, but there could be other conditions like psychosis or schizophrenia, manic depressive illness or bipolar disorder, autism, post-traumatic stress disorder, severe attention deficit disorder, severe anxiety disorders. All these are conditions which can play out, in families and can completely wreak havoc on their family life or their social life. Anything you want to add to that, Manan or Rachna?
Yeah, I think it's important to recognize that, when you start having some difficulties, you start by acknowledging that, you start by talking to your family members. But when it's really impairing your functioning, your day-to-day activities, you can certainly consider seeing a professional at that time. And the reasons that you would want to see a professional would, in this case, was mood issues and some other depressive symptoms. But if there is very severe anxiety, if there are panic attacks, if there is severe attention issues such that you are not able to perform at work or not able to perform at school, sometimes attention issues can cause a lot of issues in relationships. If there is, in terms of bipolar disorder, if there are severe mood swings, if there is severe insomnia, so all of these things you can consider seeing a professional.
And Rachna, what are some resources for family members? What can they do when they're going through this?
So I think NAMI, or the National Alliance for the Mentally Ill, is a good resource for a lot of family members where, number one, they can get scientific and factual information about these kind of mental illness, the course of how it plays out and the treatments available, and also information about support groups. Similarly, for people who have substance use issues, there are support groups for loved ones called Al-Anon, and these are good places where people can share a camaraderie or bond or connect with other people who are sailing in the same boat and having similar problems. And then also for caregivers of patients with dementia, there are a lot of support groups available, because these are the kind of conditions that take a toll not just on a patient but also on their loved ones. So while the presenting person may be our patient, we also have to keep an eye out for brewing trouble or issues in family members and support them as well.
And I'm just going to tell everybody who's watching us that we will put more recommendations about where people can get help on our Facebook page. But I think there are some new ones that have been addressing these issues in South Asians. One that I know very closely is Samhin, South Asian. It is mainly for South Asians. I have seen other website called Manmukti. So there are more of these websites and resources coming up specifically targeted at South Asian community. So, but we will post a little bit more comprehensive listing on our Facebook page after the episode. So the other request I have for everybody who's watching today is please send us your suggestions for future episodes. Follow this page, share it with your friends. We'll try to soon even start maybe a YouTube channel where even if you couldn't join us through Facebook, you could see this and share it with others broadly. But please keep sending us your suggestions for improvement, or also for what are some other things you would like to hear us talk about. I would also like to maybe bring in Payal and Shekhar, who are Rajiv and Paroma, to join us and tell us what are some of their thoughts about what they experienced as they were enacting this scenario. So welcome Rajiv and welcome Paroma as yourself. Tell us what your thoughts were on enacting this, and what were some of your reflections.
So get out of our Shaker role to becoming a Rajiv role.
Yeah.
So first of all, thank you so much, Sunil, Rachna, and Manan, for giving Paroma and myself this opportunity to be part of your forum. It was very enlightening. Learned a lot in the process as we went through this enactment. And Sunil, I'll reach out to you separately. I've been already getting some chat information about people needing to talk to you guys. So it seems like it has touched people's courts. And I think a lot of this is a reality in our culture, that a lot of people go through it, go through stress at work or go through stress in life, family, etc., but are not ready to accept the fact that it may be leading to a bigger things of depression, and not willing to see the therapist about the whole thing, because they feel कि उसको पागल करार दे दिया जाएगा या लोग उसके बारे में बुरा समझेंगे, because there is a stigma attached to this particular case of mental health, right? So this one really brings out the thing that if we get the right help at the right time, we can really turn the things around, and the family are a huge support system to go to let that person go from the feeling of illness to recovery.
So echo everything that Rajiv said. And to add to that, while I was listening, especially to Manan, I was sort of revisiting my behavior towards my teens and my daughters. And I was sort of going like, oh my God, yeah, I say that all the time. I shouldn't be. You know, some things are so ingrained in us as South Asian parents that that's our first response. And it's sort of hard to like stop in your tracks and sort of say, no, maybe that's not the right response. And every time, Manan, you said something, I'm like, oh my God, I do that. Ouch. So that, I think it's a parent re-education almost that's needed at this point, because it's very hard for us to think that way.
And thank you for being so open and so honest, and so brave to say it on open air that yeah, I sometimes do that, and we all do that. I think
all the time.
I think these things are ingrained in us right from our childhoods. We have grown up in these. It's like fish in water. You don't know and sense what the water is around you unless somehow somebody else shows you that perspective. And that is again the reason behind these conversations, is to show a mirror to ourselves, to say what are we doing and how could we. My belief is, and I've said this on previous episode as well, is that this is one thing: psychological awareness, psychological mindedness, psychological willingness to address these issues, that's actually holding our community back. I mean, we have so much potential that not addressing this can become like a handicap. And I think we should do as much as we can to, walk that tightrope and sensitively open these doors and windows so that more light can come in, but also use this information about ourselves to inform our actions and behaviors in family life, in work life, and in our communities. Any other closing thoughts you would like to make, Rachna, Manan?
No, I'm just happy that we are doing this. I hope that people find it useful, and we'll keep coming back with more.
All right. So thank you all. Thank you for joining us for the first time or again. And we hope that when we do the next episode, you will be with us and have a dialogue with us. We want this not to be just a monologue, but a dialogue between us and you. So yes, please send us your ideas about what else we could do to illuminate or bring more light to this. And it would be fun to build this awareness, this consciousness, this willingness together. Thank you all.
Yeah, and if you're having a vacation withdrawal and because of that feeling depressed or something, put on a poster like this, like Hawaii, and let's escape to Hawaii together.
Right. Thank you for joining. Thank you, Parama and Rajiv. This was this was better than listening to three of us talk in a very boring, academic, professorial kind of way. This kind of hope made it a little bit more lively for everybody. Thank you for doing that.
Thank you all.
Thank you. Thank you all.
Thank you. Have a good Sunday.
Jia.
Bye, everyone. Thank you.